Hey everybody, and welcome to Investing in Your Health. My name's Chris Steele, and today we're going to be talking about women's health. Our guest today is Dr. E.J. Jones. Before we get started, I want to thank First Community Bank for the opportunity to talk to you guys and to bring our guest on. We're really thankful for that and eager to hear a little bit more about women's health. Dr. E.J. Jones has been a friend of mine for years. We work together at White River Health System. We have an interesting relationship. I'm an anesthesiologist, and so I'm on the other side of the curtain from him, and we've been able to work together for a while. So I'm really glad he came to join us today and ready to learn a few things. So it should be a blast. With that, EJ, you want to tell us a little bit about yourself?
Thanks, Chris, for having me in, and I appreciate the bank for sponsoring this great presentation of all the community activities. I grew up in Wisconsin, but my parents vacationed down here throughout high school, and my dad, who is also a physician, decided to relocate here in Batesville. When I finished high school, I moved down here with them, went to Fayetteville, University of Arkansas, then I went down to Little Rock and went to medical school, then completed a residency in obstetrics and gynecology there, and I'm board certified in obstetrics and gynecology. I've been in Batesville since 1983. I consider myself an Arkansan now, not a Yankee anymore.
There you go. Well, that's great. I was fortunate enough to learn a little bit more about you and your family about a year ago. We got to do a toast and roast honoring you, so that was quite a bit of fun. Hopefully there's no extra copies of that video floating around anywhere, but I think suffice it to say we had a good time.
Yeah, I got roasted a bit. It was all good fun, though.
We had a great time. So from a women's health standpoint, I know there's a lot of changes with the pandemic going on that we're having. How has it really affected your practice?
Well, we've tried to follow the guidelines suggested by our public health officials with social distancing. We, in the clinic, have tried to only bring patients in one at a time, so there's no real contact. Of course, we wipe everything down in between patients. We were doing that actually before. And so we've tried to change our flow. We don't bring patients into a waiting room area. They're called in individually from their car, and I think most people in the community are doing that.
They're appreciating that, so that's neat.
And masking up, of course.
Yeah, well, I know it definitely changes a practice, but it's definitely the right thing. I'm sure a lot of people understand that. So a lot more people are staying at home regularly than they used to, working from home and doing all those kind of things. How would you recommend for women to keep themselves healthy when they're staying at home more? They're not able to get out quite as much.
You know, for every challenge, there's always an opportunity. And, you know, being at home, there's some upsides to that. In fact, I've had a lot of patients tell me their kids love COVID-19. You know, mom and dad are home now a lot more than they were. And I think healthier eating, you know, where there's less eating out, and it tends to be a little healthier if you can cook yourself, maybe fewer calories, you hope. Also, the great thing about living in rural Arkansas is we can socially distance very easily. In fact, many of our lifestyles didn't change much. I have a lot of family that lives down in Florida. They're locked up in their homes in Orlando. They can't do anything. Here, we've got all this great community, hiking, the river, Poke Bayou, lakes. We can still go fishing and engage in exercise, healthy activities.
We've had a couple health experts on to talk about how sunlight, exercise, all those things make a difference. And know you're passionate about fishing. I've seen you with some fish before. I know that's good activity. Probably helps your mental health as well as anything.
Just doing simple exercise, there's such benefit. Walking 30, 45 minutes a day, it's a great stress reliever, helps you cardiovascular wise, and it's amazing how much benefit you can get from a moderate amount of exercise. You don't have to be in the gym every day working out for hours to get exercise that's going to really give you most of the benefit of a hard cardio at a gym. The other thing is maybe doing some light free weights, cable machines, something like that to keep toned up, especially as you get older.
You have from what I remember, you do a little bit of music from time to time. Any history with instruments or anything?
Oh yeah, yeah. I've come from a family of musicians. My parents had big bands. They had Dixieland bands. They are very active in church. I guess I picked that up. I play, of course, in church. There's a jazz quartet. I play with some of the other members of our community. I play bass and keyboard.
Oh, cool. Yeah, that's another way I know that some people kind of get a release. They get to focus, activate their brain, remembering things, and also get some dexterity. So
music is such a joy if you just, and I think most people that you know that are musicians that sing or play an instrument, they really do get a release from it, almost a high off it.
yeah, well, that's great. And mental health is such a big deal. Some people get cooped up, and you need that kind of release. So that's definitely good advice. Has your screening for women's health, has that changed at all for recommendations or anything like that during this pandemic or recently?
Our overall screenings for annual exams has not changed. Of course, coming to the office, we screen with temperatures and ask about any history of possible exposures to COVID patients. And we also encourage some of our patients that don't necessarily need an exam at that time, maybe just a routine annual, and they're elderly or they have other health problems, maybe they have heart problems. They may actually benefit from not getting an exam until this all settles down. The worst thing that could happen is go for a routine exam when you don't have any problems and get exposed.
Mm-hmm. Yeah, I know some practices have been doing either telephone conversations or telemed. Have you had any experience with any of those?
Yeah, we've used the telemedicine to do follow-up exams with really good results. I think patients appreciated it. Some specialties lend themselves to telemedicine better. For example, psychiatry, where you're just talking. Generally, specialties where there's a physical exam involved, it's hard. You can only go so far with telemedicine.
Well, that makes sense, but it's good to hear you're trying to pivot the best you can rather than expose patients to unnecessary risk. So that's good. It seems like things are moving in the right direction as far as that goes. Is your practice starting to pick up now with the decline in the number of COVID patients and those things?
Yeah, Chris, we have really tried, and following the guidelines, of course, our public health officials, we've tried to start seeing more annual patients and more routine type problems. We continued to see OB patients throughout the pandemic.
So you couldn't just tell them to, I don't know, keep the baby for an extra 6 months in there before
that doesn't work.
Usually near the end of all of our talks, we typically solicit information and questions from our audience. And so thankfully we've gotten a couple questions that were specific to you. So we're going to shoot you a couple things and just see where they go. One of the first questions we got was, at what age should women start seeing a women's health specialist like yourself? Or how often?
I'm going to translate that question. When do I have to get the first pelvic exam? That's what most women, and the bottom line is usually 21.
Yeah.
21.
Okay.
There's, of course, each case is different. If you have a 19-year-old who's had a baby before, who is having bleeding problems or some female problems, then she's going to need an exam. But just to start on birth control, for example, for painful periods, most doctors now do not do a pelvic exam if the woman's under 21. She'll come in and you have to see the patient and make sure their blood pressure is good and talk to them, but you just start them on pills.
Yeah.
If they do well, they don't need an exam.
Yeah.
If they don't do well, then they have to get an exam. But age 21.
Okay, well that's good. That's definitely good
I'll
for
tell you,
people here.
I'm just going to expand on that a little bit. For young women under 21, I would suggest they consider getting the Gardasil immunization, the 3 shots that help protect against this virus called HPV, another virus.
Yeah.
There's another one out there, it's a bad actor. That virus is linked to cervical cancer, and if you're immunized against that, you're going to cut your risks significantly of getting cervical cancer or abnormal pap smears.
Yeah, okay. Well, with that, we're talking about screening to some degree. On the other end of the spectrum, how long do you recommend people as they get older to continue getting their annual visits? Does that continue? Does that stop at any point?
Gray area kind of depends upon quality of life for your patient. If you have an 80-year-old who is vigorous, alert, she may want to continue. You have to discuss it with the patient coming in for annual exams, and probably would benefit from that because she may have a life expectancy that goes on quite a bit longer. Someone who's in a nursing home where they're really disabled, they may not benefit a lot from coming in for an exam.
So it's something they need to talk to their doctor about on an individual basis.
Yeah, so there's an upper limit. There's not like a hard number on mammograms. Mm-hmm. If you read the U.S. Preventative Task Force, many of those guidelines suggest just stopping PAPs at some point, like 65. Mm-hmm. I just disagree with that. The Pap smear is the greatest success story in the history of preventative medicine. 100 years ago, the #1 cancer killer in women was cervical cancer. And you look at the numbers in this country, there are a few thousand cervical cancers. That sounds like a lot, but you're talking 180 million women in this country. So we have a lot of Pap smear screening in this country, a few thousand maybe, don't hold me to the exact number. Worldwide, third world countries where they don't do Pap smear screening, there's about 500,000 cases of cervical cancer annually now, still in the world.
Wow.
Those are impressive numbers to advocate for continued screening to me.
Oh yeah, well, I had when I was a young doctor in training, we never got really exposed very much to cervical cancer and because of the high degree of screening in the United States. And we had a person who had immigrated from another country to come in with this atypical pain that was kind of in their belly, just weird symptoms. And none of us really initially even had that was a possibility in our mind because it just wasn't. And turns out she had a very advanced case of it that was strange for somebody in a first world country. But the more we researched, the more we found it's not terribly uncommon in third world countries that don't have screening, that's still very prevalent. So.
Yeah, the most common presentation I see in a cervical cancer history-wise is going to be someone who's missed getting PAPs for many years. Yeah. Occasionally you run into somebody that gets a rapid progression. The other thing about those recommendations, interestingly, on these, when exams are done or when to stop them, is the fine print actually is they suggest that you look at the cervix. And I know that recommendation gets parsed into no exam at all. Actually, it's look at the cervix. If it looks normal, don't do a PAP. Yeah. Rather than not doing a PAP.
Yeah, well, that makes sense. Well, and that's another reason why it's good to look at recommendations but talk to your doctor about it, because you aren't just going through the list and saying, checking boxes. You've examined it and you've looked at using your long career and the recommendations and trying to figure out what specifically is best for your patient. So that's why I think it's good not to just always check boxes, but actually give it some critical thought. The other question we had here was, if you were able to go into another medical profession, what would it be and why? And don't just say anesthesia because I'm sitting here.
Yeah. This is kind of a cop-out answer, but if I was going to do it all over again, I have thought about this. First off, I would do exactly what I did. Being an obstetrician in a small town has been just a great experience. Mm-hmm. I mean, this week, I delivered a couple, I delivered them. So I always tell patients, I'm like a grand doctor. That to me is really exciting. Mm-hmm. And I really get to know families and connect with them. But if I had to choose another specialty, I guess I'm surgically oriented. I'd be more inclined to become a general surgeon, something along those lines. I think I'd probably be more of that cut.
Well, good. Well, that sounds wonderful. Well, I really appreciate your time today. Definitely helped. I know we got a ton of advice regarding women's health and what to do, and I know our audience definitely benefits from taking a lot of your advice. I thank you for taking care of our community for all these years. We're lucky to have somebody specialized like you to really improve the care in our community, so thank you.
Chris, it's been a privilege working with you at the hospital and working on this. Yeah. Thanks for letting me chat with you today.
Yeah, well, I really appreciate it. And thanks everybody for joining us today on Invest in Your Health. If you want to check us out on YouTube, we've got a couple other episodes regarding spiritual health, regarding bone and joint health, dental health, pet health, a lot of different focuses. So thank you so much, and please give us some feedback. We love to hear from you. That's how we get some of our episode ideas and certainly some of our questions we ask. So you'll see our contact information on the page to follow. So again, thank you for spending time with us today, and thank you for investing in your health. Have a great day.